Mesothelioma is a type of cancer that affects the mesothelium, which is a protective lining that covers many of the internal organs in the body. The most common type of mesothelioma is pleural mesothelioma, which affects the pleura, the lining of the lungs and chest cavity. While there is no cure for mesothelioma, treatments such as surgery, chemotherapy, and radiation therapy can help prolong life and provide symptomatic relief by reducing tumor size and slowing cancer growth and spread. All cancer treatments also come with potential side effects as the therapies affect both cancerous and healthy cells. The side effects vary for each individual and depend mainly on the extent of the disease, type of treatment, duration of treatment, and the person's overall health and resilience. Here are some of the most common side effects experienced with mesothelioma treatment. Fatigue. Fatigue is one of the most relevant side effects experienced with mesothelioma treatment. It is caused by the effects of the disease itself as well as the side effects of treatments like chemotherapy, radiation therapy, and surgery. Fatigue may range from tiredness to exhaustion. It affects both physical and mental ability and can be permanent or temporary. Nausea and vomiting. Chemotherapy is one of the main pillars of treatment for mesothelioma. One of the most common side effects of chemotherapy drugs is nausea and vomiting. The extent of nausea depends on the specific chemotherapy drugs, dosages, and individual tolerance. Nausea usually occurs with the administration of the chemotherapy drugs but can persist for a few days. Anti-nausea medications are usually prescribed to control these symptoms. Pain. Pain is a predominant symptom that almost all patients with mesothelioma experience. The extent and type of pain depend on the location and size of the tumors. Treatment itself such as surgery to remove tumors or radiation therapy near vital organs can cause pain as healthy tissues are also injured in the process. Other causes of pain include scarring and binding of tissues caused by tumor growth as well as side effects like fatigue which increase a patient's perception of pain. Strong pain medications and therapies are prescribed regularly to control pain. Infections. Risk of serious infections is increased with mesothelioma treatments since they can compromise the body's natural immunity. Chemotherapy weakens the immune system as it destroys fast-growing cancer cells as well as healthy cells. Surgeries and radiation therapy can also cause wounds and damaged tissues through which bacteria and viruses can enter the body. Common infections during or after treatment include respiratory infections like pneumonia, urinary tract infections, and bloodstream infections. Antibiotics are given preventively or to treat infections as needed. Low blood cell counts. Chemotherapy affects the bone marrow, where new blood cells are produced. This can result in low blood cell counts, especially low white blood cell and platelet counts. Low white blood cell counts increases the risk of life-threatening infections while low platelet counts raises bleeding risks. Growth factor injections are given to stimulate blood cell production or blood cell transfusions are required. Anemia. Chemo side effect of low red blood cell counts is called anemia. Anemia causes symptoms like fatigue, weakness, difficulty concentrating, headache, and shortness of breath. Mesothelioma itself or excessive bleeding due to low platelets can also cause anemia. Treatment involves iron supplements, nutrition improvement, blood transfusions or treatment of the underlying cause. Reduced appetite and weight loss. Decreased appetite is a very common side effect during treatment for mesothelioma. It is aggravated due to physical side effects like nausea, pain, fatigue, and changes in taste or smell. This commonly results in unintended weight loss which weakens the body. Nutritional supplements and medication to boost appetite may help mitigate this effect. Diarrhea. Loose motions or diarrhea is a side effect caused by some types of chemotherapy drugs. It can range from mild to severe. Diarrhea can lead to dehydration, which needs to be prevented by drinking plenty of fluids and electrolyte replacement. Antidiarrheal medications are used to control diarrhea when needed. Constipation. Constipation is another common digestive side effect that mesothelioma patients experience due to chemotherapy, pain medications, lack of activity during recovery, or tumor growth affecting the bowels. Maintaining adequate hydration, Fiber-rich diet and use of laxatives help manage constipation. Mouth sores. Chemotherapy can cause inflammation and sores inside the mouth known as oral mucositis. It creates ulcers and makes eating, swallowing and speaking painful. Mouth rinses and medication help provide relief. Sores can also affect the esophagus and intestines. Neuropathy. Chemotherapy drug side effect of nerve damage or neuropathy causes numbness, tingling, pain and loss of sensation in hands and feet. It can range from mild to severely debilitating. Neuropathic pain medications and management techniques help address this complication. Hair loss. Chemotherapy is a well-known cause of hair loss called alopecia. It often begins within 2 to 3 weeks of the first cycle and hair regrows once treatment is completed. Cold caps placed on the head during chemo can help reduce this side effect in some cases. Fatigue, pain, and other long-term side effects can persist for months or years even after treatment ends. Early detection and timely medical management optimizes quality of life during and after treatment for mesothelioma despite the challenges posed by side effects of this aggressive cancer.